Welcome to Women in Motion, a webinar series presented by the HSS Women's Sports Medicine Center and Education Institute. These conversations are designed to support women's health and movement across every stage of life. Today's topic focuses on an important and often under-recognized aspect of athlete health, relative energy deficiency in sport, or REDS. Whether you're an athlete, coach, clinician, or simply interested in learning more about how nutrition, training, and recovery affect performance and long-term health, this discussion will explore the role of energy availability in the body and the potential consequences when those needs are not met. We'll discuss how REDS impacts health and performance, how it presents across different populations, and what athletes and healthcare professionals can do to recognize, prevent, and address it. I'm Polly de Mille, and I'm pleased to introduce our speakers today. Dr. Ellen Casey is an attending physiatrist at the Hospital for Special Surgery. She specializes in treating sports injuries and spine injuries with expertise in female athlete health, including REDS, stress fractures, and the pregnant athlete. Heidi Skolnik is a nationally recognized nutrition expert and thought leader with over 30 years at the HSS Women's Sports Medicine Center. She specializes in sports and performing arts nutrition with expertise in treating the female athlete triad and REDS. To begin, let's take a step back and look at the big picture of relative energy deficiency in sport, or REDS, and why it has become such an important topic in athletes' health and performance. So, Dr. Casey, can you explain what is relative energy deficiency in sports?
Sure. So that's a term that's used to describe a concept when there's just a mismatch between the food that the athlete is taking in, or energy intake, and the amount of energy they're expending to do their sport, as well as keep their body healthy and functioning. So if an athlete gets in a situation where they're taking in less energy than they need to, do the needs of their sport, there's not enough energy left over to keep the body running. And what can happen is there's a variety of different, negative impacts on the athlete, including physical health, mental health, as well as impaired performance. And we're going to talk about all those details today.
So, Heidi, what determines a person's energy needs?
Well, first of all, remember we have to provide energy for everything in our body, our physiology. So your heart, your lungs, your kidney, your digestion, your reproductive health and hormonal system, your brain, your gut, everything needs energy. And then depending on your stage of life, like for youth and through adolescence, right, we're also fueling growth. And then there's bone turnover and repair. So we're fueling all of those things plus the energy you need to actually do your sport. So whether you're, running, shooting hoops, swimming, whatever your sport is, you need energy for that. When you take in too few calories, your energy goes toward the most immediate need, which will be the activity you're doing. So I'm running, I have energy to run, but now I'm taking away from the energy I need for all of that physiology. And so that's low energy availability left for all of those other physiological functions, because I've now just fueled the most immediate thing, my sport, when I'm not taking in enough calories.
And what does low energy availability actually mean, and how do you determine somebody's daily requirements for energy?
Well, I'm going to look at exactly all of those things: their stage of life, their gender, their muscle mass, what activities they're doing, and I'm going to look at their food intake, right? Are they taking in enough? Are they missing snacks? Are they restricting certain food groups? And that can come from a lot of things. That can come from purposeful diet behavior, but that could also just come from food insecurity or from a really busy schedule that is really, time management is a piece of this. So it can be, an inadvertent way of getting to not getting in enough of what you need and creating this low energy available state.
What happens when someone is not fueling enough and to maintain their adequate energy stores?
Right. So as Heidi was explaining, that fueling is required not only for sports performance, but maintaining, physical and mental health. And in the short term, you might not realize it. You might get away, an athlete could get away with it, not knowing that this is going on, even, where there's really no negative impacts that they can tell. But what can happen is if this is sustained or it kind of continues to occur, then, the big things that people might notice are overall, they just don't feel like they're doing as well or performing as well as they want to be. They may not be recovering as easily, feel like they're getting sick more often or getting injured frequently. And so all of those things are what will bring an athlete to see someone like Heidi and myself. And in particular, one of the best known consequences of underfueling is injuries to the bone, so stress fractures. And that's often what people will bring, them into my office to see, they want to get better from the stress fracture and get back to their sport. And what stress fractures are essentially just micro little trauma to the bone that can kind of build up and lead to a crack or swelling in the bone. And it's important to know that when we exercise, we always break down bone, and that's normal process. And then when we are recovering, our body builds that bone back up. And if it's nicely balanced, that actually keeps the bone healthy and strong, that breakdown and build up. But sometimes there's more breakdown than there's build up, and that's when you get into that stress fracture, get pain, and aren't able to do your sport. And we know, as we've just said, if there's not enough energy or calories and fuel there, sometimes the body can't build that bone back up quickly enough, and that's when that stress fracture occurs. And so making sure that fueling is adequate is one way to prevent those injuries and avoid, having time out of sport because of a stress fracture.
And Heidi, as a sports nutritionist, what are sort of common misconceptions that you run into among athletes regarding fueling and adequate energy for their sport?
Well, I think right now one of the current trends that is most harmful is, of course, the low carb or carbs make you fat myth, right? So carbohydrate is just essential for everybody, but especially for athletes. It's what fuels our muscles. It also fuels our brains. It does a lot of different things. There's lots of nutrients. But from a fueling perspective, really, we need carbohydrate. And so there's really some new research that still needs to be fleshed out more, but actually looked at low carbohydrate even when calories were adequate. And that showed some harm to immune markers and bone turnover markers. And so that's really kind of interesting to see that even when energy was adequate, low carbohydrate can be harmful.
So that would be like currently this big protein sort of fad that's going on where people would be getting like a lot of calories, but it's all coming from protein versus not having carbohydrates.
Well, yes. I mean, the thing is, we talk about the balance plate for athletes, right? And you still need protein. Protein is really important. And so it's the idea of maxing, right? Like protein maxing or fiber maxing. You need adequate protein. And yes, athletes might need a little bit more, but they're mostly taking in more calories, although it depends on, the sport. But they also need adequate carbohydrate. So it's not about having one or the other, but having the adequate amount for each. And the more active you are, the more carbohydrate you need. So it is true for those people who are more sedentary. They don't need as much carbohydrate. It doesn't mean they don't need any. And the more active you are, the more you do, the more you need, the more fuel you need.